Hey, everybody, and welcome to Taproot Conversation. I'm Nicole Bonner, a chiropractor in New Jersey.
And I am John D'Ambrosio, also a chiropractor in New Jersey. And we are here with an extremely special guest today, Dr. Christopher Kent. Could you tell us a little bit about yourself?
Okay, well, there are some interesting things in my past. I'm a 1973 graduate of Palmer College of Chiropractic, and I'm also an attorney, and I've done a lot of interesting things in chiropractic. I was privileged to serve as an NGO representative and chairperson of the NGO Health Committee at the United Nations. And right now, I'm on the faculty and staff of Sherman College of Chiropractic, where I serve as a professor and director of the Center for Scholarly Activity.
Awesome. And you forgot to mention pilot.
Oh, that's just for fun.
So, tell us a little bit about what made you want to become a chiropractor.
Well, it's really interesting because I was in a position, I think a lot of our viewers may be in, where I was trying to decide what to do with my life. And I knew that I wanted to help people. I knew that I would like to be in a position where I was able to create a situation where people could express their life potential. So I really thought in terms of human potential. And as a consequence, I was exploring things like psychology. I was always interested in alternative healthcare. I knew I would like to be some kind of a doctor, but not really aware of what. And I looked at all kinds of stuff: podiatry, dentistry, naturopathy, osteopathy. And I was discussing this with my then best friend. And he said, well, have you ever considered chiropractic? And I said, well, I really don't know much about it. I've just passed by chiropractic offices when traveling through town. That's about the extent of my knowledge of it. What do you think? And he said, well, why don't you talk to my chiropractor? And at that point in time, my mother was working at the medical college. And I thought, well, I'm 16 years old and I need some information about this. I'll ask my mother. And I said, what's a chiropractor? And this look of disturbance came over her face, almost a scowl. And she said, a chiropractor? Why, that's someone who cracks your bones. And I said, cracks your bones? You mean they fracture? And she said, I guess they must. You can hear them snap. And I thought, why would anyone have that done? And she said, I don't know. I wouldn't go. Well, at this point, I had a significant contradiction to resolve. My friend, who was seemingly rational and certainly ambulatory, was telling me about the benefits he's experienced as a patient of chiropractic, and my mother's talking about fractures. So I thought, well, how can I find out some more without risking life and limb? So I made an appointment with a nearby chiropractor, told him I was doing a report for school. Could I come and interview him? And he said, of course, come right over. And I asked him that question we've all been asked so many times, and that is, what is it that chiropractors do? And his response is still one of the most concise and eloquent I think I've ever heard. He said, chiropractic is based on 4 simple ideas. He said, the first is that the body is a self-healing mechanism. Cut your finger and it heals. Cut the finger of a corpse, it doesn't. It's life that heals. He said, secondly, every dimension of the human experience is processed through the nervous system. Every thought, every feeling, every motion, every emotion, and all the things that are going on that you're not even aware of, like digesting food and producing insulin and your heart beating faster when you run. Every aspect of your life is processed through the nervous system. And the third item gave me goosebumps then, and it still does now. He said, if there's interference with the function of the nervous system, not only can that compromise your physical well-being, but because it alters your perception of the world and compromises your ability to respond to the world, it can have psycho-emotional consequences too. And when this happens to a significant number of people in a society, you have a sick society. He said, finally, what I do as a chiropractor is locate and correct the cause of that interference. And I thought, wow, what a concept. So to make a long story short, I became his patient. Health problems I had never even discussed with him resolved, but more importantly, I had a feeling of energy, vitality, a focus on purpose that I had never enjoyed before. And it wasn't long before he said, I think you should become a chiropractor. And the rest, as they say, is history.
That is awesome. I love that. So when you went to school, obviously school is different than it is now. How would you compare your education to, say, what you're seeing at Sherman, since you're intimately involved there?
Well, there are some significant differences. We had a much more heterogeneous student body. We had people who were second career students. We had individuals who had just completed their pre-professional requirements. So, you know, we had everything from 18-year-olds like me to people who were in their 60s. And the thing that all of them had in common was that there was some previous experience with chiropractic. They were either a patient who had experienced the benefits of chiropractic care. They were the children, nephews, nieces of chiropractors, and they were there because they had a strong passion for chiropractic. And today we certainly have those individuals, but we have students who have never experienced chiropractic care that just thought it might be a good career or that found it intellectually appealing. So that's one difference. Another difference is how that heterogeneity of experience, literally everyone from people with GED certificates to PhDs, made teaching a challenge in the early days as well. We also at Palmer had huge classes. We had some classes that had as many as 200 or so students in them, whereas at Sherman we have a smaller, much more intimate family type situation where, as they said in the old TV show, everybody knows your name. But what I found interesting is that the fundamental philosophy of chiropractic, while it's become more sophisticated, is still the same. Yet our technology, our ability to locate, correct vertebral subluxation has become technologically advanced. We have things that didn't exist when I was a student. When I was a student, we didn't have CT and MRI. We didn't have anything like the Insight subluxation station. We didn't have cone beam CT. We didn't have sophisticated adjusting instruments for people who like that approach. And as a consequence, it's nice to see how this philosophy has permeated technology so that we're able to offer better quality care than ever before and have objective assessments that we have indeed produced a positive change in nervous system function.
And that's huge.
Yeah.
Yeah, and I think that brings us right into our next question that we have for you. And you've been called the smartest man in chiropractic.
Well, I always tell my students, anytime you have at an absolutist position, the biggest, the best, the strongest, the weakest, the ugliest, the happiest, you're probably dealing with the problem because it only takes one exception to falsify it. So I make no such claim. I do have a lot of diverse interests, and as a result, you know, I've done this stuff. You know, I was interested in body-mind relationships, so I got a master's degree in psychology. I was interested in holography and the holographic nerve model, so I took a course in optical holography. And at the UN, it seemed everyone was a lawyer, so I became a lawyer. And all of these things have really entered into developing skills that ultimately helped me to be more effective in teaching chiropractic to others and bringing it to the world.
Yeah, and you know, one of the things you're so well known for in our profession is the science and research of chiropractic. So with that being said, you know, we've been told a lot of times, you know, I've been in practice for 21 years. And John, how long have you been in practice?
Almost 30.
Almost 30. And, we've always had that dichotomy where we've been told that that chiropractic, the science of chiropractic and the philosophy of chiropractic kind of contradict each other. What are your thoughts on that? Do you find that to be true, or how do you feel about
certainly
that?
not. Quite the opposite. It's a false dichotomy, and it's been created by individuals that I think have a political agenda. There are individuals both within and outside the chiropractic profession that would like to see us limited medical practitioners, like an optometrist or a dentist or a podiatrist, that essentially accept all of the premises of medicine and its model philosophically. And in chiropractic, the truth of the matter is that the breadth of our influence is as broad as the scope of influence of the human nervous system. And when you realize that we're about allowing people to experience life to its fullest by ensuring that the nervous system is working without interference, that opens up a whole new world. And it doesn't necessarily contradict medicine, but it addresses issues that are simply missing in medicine, but have a profound impact on the human experience. So by having an understanding of the fundamental philosophy of chiropractic, by understanding biases and logical fallacies and being able to think clearly, being able to apply both the inductive methodology of conventional scientific discovery with the deductive methodology of allowing our principles to unfold and integrating those things, we have something very powerful. I often speak to interdisciplinary groups, and what I find is that many of them embrace concepts very similar to ours, but they don't have a methodology for translating them into a clinical procedure and a healthcare reality. And it's really exciting to see people who are thinking in ways very similar to ours become excited when they see that there is a clinical application.
Awesome. Thank you.
Yeah, and that's so important. But for students, there's a lot of students who are not getting the philosophy. Sherman is known for teaching the philosophy. How important is it for students to have that philosophical leg of their tripod of philosophy, art, and science just as strong as the other two legs?
Oh, I think it's extremely important. I think that you need the philosophy, the science, and the art. You have to understand clean thinking. You have to understand the major premise of chiropractic and the various things that unfold from it. You need the clinical application in terms of the art, and you need a scientific understanding to bring it all together and to test your premises.
And do you feel that looking at things through the philosophical lens, looking at the science that way, helps you bring everything to a whole new level of understanding, because you may have missed things without that philosophical lens to help you?
Oh, I agree completely. And all one needs to do is look at institutions that do not teach traditional chiropractic philosophy, and you see what happens when people are kind of operating without a rudder, and they're just saying, well, what am I going to do? I want to help people, so I'll do anything to help people. I just want to relieve pain, so I'll do anything to relieve pain. And until you understand the concept of there being an intelligence in the body that is self-organizing, that allows us to adapt, that allows us to grow, that allows us to expand the scope of the human experience, once you have that philosophical understanding, it then becomes an issue of how can I best express this? How can I most effectively assess a patient? How can I most effectively find ways to correct the vertebral subluxation so that the patient's nervous system can work without interference and they can have this expression of life that is their gift as a human being, but in many cases is suppressed. If you find yourself trying to treat conditions, if you're trying to suppress symptoms rather than allowing the body to decide what the qualitatively and quantitatively appropriate response is to a change in environmental dynamics, Yikes. I'm not as smart as the body.
No, and many people think they are smarter than the body,
They do.
and that's huge. I mean, it's humbling, but it's something you need to address every human being with. And that's a, I don't want to say a lost art, but it's a lost concept. And I'm glad you brought that up.
Yeah, I think it's really important. When you try to outsmart the body, when you think you know what chemicals in the blood should increase or decrease, or you think that you should know whether the heart should beat faster or slower, or you think that you have a methodology to suppress pain. Well, the pain is there for a reason. And if you don't address the underlying cause, you can actually end up doing quite a bit of damage by suppressing the body's expression and adaptive strategies.
Definitely.
Yeah.
First thing that came to my mind is vaccination.
Mm-hmm.
You know, to talk about suppressing the body's adaptive strategies. So, Chris, you offer a paid monthly subscription service to all chiropractors and students that's called On Purpose.
Mm-hmm.
So can you tell us a little bit about On Purpose and why you feel it's so important?
Oh, sure. Well, we started On Purpose a long time ago. I don't know how long Dr. D'Ambrosi has been with us, but it's been a while. And On Purpose was our way to maintain communication with our community. And we started out on audio cassettes, not wax cylinders, as some people think. We're not that old. But I remember we did cassettes, and we had someone call us and say, you know, I can't buy a car with a cassette player in it anymore. Can't you do CDs? So we said, okay. So we did CDs, and we still offer CDs for those who want them. But people are saying, cars don't have CD players anymore. Can't you have an app? Can't I do this on my phone? I said, yeah, we can make that happen. You can do it on your PC. You can do it on your phone. And what we sought to do was produce 3 programs a month, one dealing with science, where we look at the latest information from the chiropractic literature, the biomedical literature, and the basic science literature, and relate it to chiropractic and its clinical implications. The second is politics, which is extremely critical in chiropractic, where we have individuals that would indeed try to suppress our ability to do our work. And the third is philosophy, which of course is extremely critical. And philosophy usually involves interviewing someone either within or outside the chiropractic profession who has a story to offer that we think is very valuable. So that's available. Most chiropractic colleges have the CDs available in the library at no cost, though if you choose to have your own subscription, we offer that at half price. But it's quite interesting. We actually had one chiropractic college library saying, stop sending these to us. We don't like them, even though they are free. So that's kind of bizarre. But in most colleges we do. And if your college doesn't, let us know. And we'd be happy to offer them a subscription to the CD version if they so desire.
That's great. And I think that's invaluable information, because we can't sit there. I mean, we can, but we're so busy with practice to try to sit there and pour over various journals. I mean, when you go over things, you go deep and you take them from mainstream journals, obscure journals, international, and you really review the information and put it in a context that people can actually understand it and apply it, which I think is a much needed resource in our profession.
Oh, well, thank you. And one thing we've also done with the app at the request of a lot of people is break it up into bite-sized pieces. You know, in the past, you just listened to the show for the duration, typically an hour or so, for each of the 3. But with the app, we have all the topics listed and the duration of each little presentation, which could be, 2, 3, 4, 5 minutes. So if you're standing in line somewhere and you've got nothing to do, you can take a look at the app and say, well, gee, I kind of resonate with that. I'd like to learn more about heart rate variability, or chiropractic care for pregnant women, or chiropractic care for children, or what some politician is trying to do to us that we're trying to stop, whatever you find interesting, and you only have to commit a couple minutes to it. And that's another thing I have noticed, going back to one of your previous questions about today's students versus the students of the past. The attention span is much shorter. People are used to communicating with devices, and as a consequence, we've adapted by breaking down our program into bite-sized pieces and making them available as an app.
That's great. And tying into that, because you're doing this and you're teaching and you're involved in research, you kind of have a bird's eye view of the profession. How would you say it's changed in the past 10 years?
I think there has unfortunately been a movement toward the perception of chiropractic, both by practitioners and the public, as being kind of a musculoskeletal thing. I've been to situations where people, well, what do you do? Well, I'm a chiropractor. And they invariably grab a body part, their neck or their back, and they say, oh, I could use you. And at that point I say, good thing I'm not a gynecologist or urologist. I don't know what they would do. But nonetheless, they think of chiropractor as a pain doctor for the spine. And it's so much more than that. Whereas in the earlier days, I think there was a better understanding of what chiropractic had potentially to offer the public. And individuals seeking to, as Robin Williams' character said in Dead Poets Society, suck the marrow out of the bone of life. And that's really what we have to offer. So we faced that challenge, that we're perceived as being a medical specialty rather than a separate profession committed to an objective that really no other type of doctor focuses on.
And Chris, where do you see chiropractic going in the next 10 years in the future?
Well, if you are a prospective student, that's up to you. Where do you want to take it? We now see people looking for answers. We see people that have been deprived of the lives that they loved before. They're isolated. They are socially disconnected. They are feeling mental health stresses, the likes of which we've never experienced before in the world. A report from the CDC was talking about how more people have been entering therapy, more people have been reporting mental health issues, more people have been contemplating suicide as a result of the pandemic and the various encumbrances that it's placed on our humanity. And chiropractors have the ability to help people express their humanity. They have the ability to help individuals reconnect to themselves, to others, and to the world in general. And as a consequence, I think that this has provided chiropractic with what could become our finest hour. Chiropractors have always stepped up when there was a challenge. Chiropractors have always served during natural disasters, be they terrorist attacks like 9/11 or what we're currently facing. And I think that if we step up, if we allow ourselves to be all that we can be, we have a tremendous future.
Awesome.
Yeah. And kind of going along that same theme, ever since, I went to school back in 89 at Life, and up until the present, invariably when I attend a seminar, they'll always say, now is the best time to be a chiropractor. Do you feel that's true continuing forward, especially based on what you just said? Is this the best time, a great time to be a chiropractor?
No, it's your perception. It's what you think. If you think it's challenging, it'll be challenging. If you think it's a great time, it'll be a great time. If you know that your patients need you more than you need them, and you have a mindset of serving humanity, and in so doing, experiencing the joy that comes from empowering other human beings, then it's a great time to be a chiropractor. If on the other hand, you think you're just one of many purveyors of a pain treatment strategy in competition with medicine, physical therapy, massage therapy and so forth, maybe it's not such a great time for you. And that goes back to what you said earlier about the necessity of having a firm understanding of the philosophy of chiropractic, and then the commitment to technical excellence to do the best job you can for your patient.
Absolutely.
Awesome. So if there was one piece of advice that you would give to a chiropractic student that would make the most impact in their lives, what would it be?
Well, I think of the words of Victor Hugo, and he used to say, there's nothing more powerful than an idea whose time has come. And I would say I respectfully disagree with that, because the one thing that's more powerful than such an idea as an individual who has the vision, the compassion, the commitment, and the clinical skill to make that a reality. And as a chiropractor, you can do that not only for yourself, but for other people.
Love it. I think
That's
that is
awesome.
a fabulous way to end this.
Okay, well, thank you for having me. It was fun.
Thank you. You've shared some great information. I really think students and anybody who listens to this is going to get a lot of value from it. So thank you for sharing your time and your wisdom.
Well, thank you, John. Appreciate it.
Yes.
Appreciate all that you folks are doing for chiropractic as well.
Thank
Thank
you.
you very much.
Thank you
And
for your contribution.
yes, and we will put information on how to get On Purpose. At the end of this, we'll have a separate screen. So anybody who wants to jump on board and get that, which is highly recommended, so they'll be able to do it. So again, thank
Terrific.
you.
Awesome.
All right.
Thank you. All right.
Bye.
Bye, everybody.